Hello everyone, this is Dr. Marzban from Marzban Family Chiropractic Complete Injury Centers, talking from Carrollton, Texas. Today, briefly, I'm going to be talking about the high-low shoulders. And Many of us have gone to the doctor's office, and sometimes they look at your posture and they said that you have high shoulder or high on the right side, or you have the high shoulder on the left side, and they try to fix that for you, and which is good to get fixed. But in order to do that, we need to make sure that we understand what the problem is. If I go to this slide, it shows that we have this individual, and it appears that the left shoulder is higher than the right side. And if you draw a line from the top of the shoulder to the shoulder, or from the armpit to the armpit, you notice that there's a slight uh, change of the direction of the line is not complete in horizon. And the spine looks very much even and balanced. And based on the picture that we see, even though the head is slightly rotated to the right, and you see that we have a larger area of the ear or the chin appear on the right side. And that could be because of the muscle are not balanced in the neck, and or the spine is not balanced. And if I look at this individual, you see that the right side of the body musculature is more developed. Is the latissimus dorsi, which is the major muscle that brings the shoulder down. And here is the teres major and minor infraspinatus, somewhere on here. We have the delta. These muscles, all this, are much bigger and more developed than the left side. And you notice that the angle of the mid back on the side of the back, it is more oblique than the other side they compared to the left side. And you notice that there's a bigger and more developed muscle on the right side. So definitely this individual is right-handed. So if you go to a party, and you notice that the someone, a friend or someone that you associate with, and you notice that the left shoulder is lower, you tell that person, "Are you left-handed?" And most probably that person is. And since we don't have many left-handed people as compared to the right-handed, and they become surprised. So how do you know that I'm left-handed? And they didn't tell you. And but 98%, roughly, based on my experience, is that if the left shoulder is lower, the person is left-handed. If the right shoulder is lower, the person is right-handed. If there is no other major issue is going on with the person. See what other things could be causing that shoulder imbalance. We talk about the muscles, could be pulling, pushing, bringing shoulder up, down, sides. And here is the latissimus dorsi, teres major, minor, infraspinatus, deltoid, supraspinatus, and all these muscles, rhomboids. And all these muscles right here, they are trying to elevate the scapula right here, try to hold the muscle, I'm sorry, the shoulder in a place, and they're pulling, pushing, and everything else. And it depends on the direction of the shoulder we are talking about. And so if these muscles on one side and these muscles on the other side, they are not balanced, and therefore the shoulders, the top of the shoulder will not be even up, and one side is going to be higher than the other side. If that's the case, and if I adjust this spine and 120 times, that is not going to be a good service, because the spine right here, I can align it 100% to be in line, but since the muscles are the issue in this case, that alignments is not going to be doing a good job. And so beside the alignments of the spine, I need to balance the muscles on the right and left side. So that is very important. And but most of the you know clinicians might be only looking at the spine and ignoring the muscles that are very important to deal with. Beside that, we have the nerves, which are going to the side, and these nerves from the spinal cord, they're connected to the spine, I'm sorry, to the brain, and all of those nerves can be making a change in the posture, and it depends on the flow of the nerve conduction. And so either it could be the irritation of it. For example, if someone has a disc issue in the cervical, neck, or thoracic, upper and mid back, or the lumbar, which is the lower back, and if there is some disc issues and pinching or changing the conduction of the nerves to the sides, that goes to the muscles and the organs and everything else, that can change the balance of the body. And so it could be the muscle the issue, it could be the spine issue, it could be the nerve issue, and even the brain itself, if the right and left side of the brain are not balanced as far as the functionality goes, emotion, logic, so forth and so on. You have heard that the person is right brain or the left brain, and that itself can change the balance of the body for some amount. So we need to make sure that what we are dealing with. And again, the right shoulder and left shoulder could be different, sometimes because of the imbalance of the pelvis or the we talked about in the previous videos about the long leg or short leg, and that could be changing the balance right here, which is making the right and left shoulder not to be even up, and or it could be a scoliosis in the spine. So all of those are factors to the change of the right and left side heights. And if I go to the next slide right here, and again, if I look at these two individuals right here, you'll notice that there's the bigger area of the space between the side of the body and the arm. On the left side here is bigger right here on the right side. This individual has the left shoulder down. This individual has the right shoulder down. And I can guarantee that this individual is left-handed and this individual is right-handed. And even though if I look at the legs, it seems like he's tilted and the pelvis is not balanced right here. And if I look at this one, the leg is a little bit moved to one side. All of this could change that, change the posture balance. And so all of those could be considered as the factor of affecting the right shoulder and left shoulder not to be even up. So if you go next time and to see a physician, a clinician, therapist, and they're trying to fix your shoulder balance and or the hip balance, and making sure that they can describe to you, is it the nerve, is it the spine, is it the muscle, is it because of the long and short legs, and what other factors could be the issue that the clinician is trying to fix to make you a better balance. And these are all going to be important for every individual, But as someone age to, over 50s, 60s, and that's the time that balance becomes very important. Even in the younger people that they go to gym and do the liftings, or runners, and someone is trying to run straight, and all of those uh, are very important to have a good balance in the posture and the body. Otherwise, they gonna be hurting something sooner or later. The ankle, the knees, the hips, or the spine, the neck, and um, I just want to make sure that we are understanding the purpose of looking at the posture and how we should be dealing with it. Thank you so much.